So physical exam of a patient with headaches. The first thing you want to do if a patient comes into the emergency room or to your clinic, what are the vital signs? And we've learned a lot. Pulse, blood pressure, especially, fever, especially. Because fever plus headache, think about meningitis, think about encephalitis, think about sinusitis, even think about subarachnoid hemorrhage. Subarachnoid hemorrhage can cause some level of fever. Okay? If the patient has severe, like elevated blood pressure plus headache, then think about hypertensive emergency. Then in a patient with headaches, you also want to check the sinuses as well for evidence of sinusitis. And then temporal arteritis, you can palpate the temporal region to check. If the patient has maybe a reduced pulsatile artery there, that can also suggest it. And then you also want to examine the dentition and the temporomandibular joints for tenderness. Okay? And then you also want to examine the eye. So I have a question. A 32-year-old gentleman went to the movie theater. And as he was in the movie theater, when the movie screen was about to come on, he started experiencing severe headache and now cannot see well.
Angle closure glaucoma.
Yes, it is angle
closure glaucoma. So, if you have a patient who, people are getting smart, man. I'm really liking this. If you have a patient who is, moving from a dark place to a very bright place, and then they have visual blaring, headache, think about acute angle closure glaucoma. Okay, so with acute angle closure glaucoma, what other symptoms will the patient present?
Nausea and vomiting.
Nausea and vomiting. What else?
Abdominal pain.
Abdominal pain.
Abdominal pain. And then what is the next best investigation you will do?
You measure intraocular pressure.
What will you use to? Oh, beautiful, tonometry. Beautiful. Tonometry. So you see, doctors, you see the way we are going about it. Okay, so I do, and I can also do fundoscopy, and I do fundoscopy, and I see papilledema, flames. I'm going to think about severe hypertension. I'm also going to think about raising intracranial pressure as well. Then I also want to do a mental status exam. The patient may be confused, right? Signs of meningeal irritation. What are some of those signs of meningeal irritation? Neck stiffness, connects where you flex the head and then the patient will move the lower limbs, right? And then you also want to assess the cranial nerves as well. And then you also want to do motor and sensory function. And you want to check the patient's reflexes, the patient's gait, cerebellar function. And then you want to check for papilledema, altered mental status, and focal neurologic deficits. These are predictive of intracranial pressure. All right? So doctors, please learn the patterns. Learn the patterns. That is all you need in order to do very well in your exam. Okay. So, you have a patient with abnormal neurologic examination plus headache. What's your next best investigation? Abnormal neurologic exam plus headache. What's your
CT?
Non-contrast
CT, non-contrast.
Okay, so I got these answers. CT head, non-contrast CT, head. Please, which of them?
Head CT non-contrast. Head CT non-contrast.
So non-contrast CT. So, in your exam, the other thing is, you may know your answer, but the way you put your answer, if you just go saying CT, is this CT of the abdomen? Is this CT of the pelvis? So if you have a patient with abnormal neurologic symptoms plus headache, your next best investigation will be emergency neuroimaging, and that neuroimaging should be a head CT. Specifically, it can be a non-contrast head CT scan. Okay, good.